Great. I see the future with many health coaches working with doctors, functional medicine doctors. Interesting stat is doctors are not trained as behavior agents at all. They diagnose, they treat, they inquire, they put plans in place. But to maintain someone's sustained transformation takes personal accountability, takes a community. Dr. Mark Hyman from the Cleveland Clinic said the greatest force to bring about change is a community. Interviewing Dr. Jeffrey Bland, the father of functional medicine, on the podcast, he's introduced me to group visits at the Cleveland Clinic where you've got a functional medicine doctor, you've got a cardiologist, you've got 8 patients, you've got a couple of health coaches. We're partnering with Chris Kresser, who's got an international health coaching federation in the States. What do you think about health coaching and the future of health coaching in South Africa?
So, look, for me, the biggest problem that we have in clinical practice, it's not sometimes about the actual consultation or the treatment approach. You get it right most of the time. It's what happens to the patient in between visits. So 90% of the patients who will see you, when they leave you, they understand what's wrong and they're super motivated to exercise and to eat correctly and to do all the right things, okay? And after a week, you're back to square one. And because you're not monitoring yourself in between, you don't assume it's not getting better, or the levels are not improving until your next visit, okay? And that's how it carries on every 6 months with our patients. So the biggest intervention or success in actually getting patients well is holding their hand through that intermediate period, in that middle part of from where they're being seen by one visit to a doctor to the next visit. And again, like everything else in healthcare, well-being or wellness is also siloed, okay? So you go and see a dietitian who gives you a story, and you see a different dietitian and they give you another story, okay? And then you go to a biokineticist or a personal trainer and they do their own thing. And then you do a course online that's motivational, and somebody is telling you to do something different, and then you go and see a psychologist maybe, right? So everybody is trying to help you with what you're presenting with, but nobody's actually put together a coordinated approach to well-being. And that's what we're busy building at the moment, is how do we offer a science-based well-being model in a virtual space, okay, to the millions of people out there who don't have access, firstly, okay? So health coaches are absolutely crucial.